I want to welcome Denise back. Denise Fair Razo, if I got that right. Did I get that
Yes,
right,
you
Denise?
did. Yes.
Awesome. And since we last saw Denise, she has gotten married. But I'll do some background on Denise because I think it's so important in her position. She is the Chief Public Health Officer for the city of Detroit, and he oversees the Detroit Health Department, which is so critical today. She leads a team of 250 healthcare professionals who protect and promote the safety, health, and well-being of Detroiters. The health department operates more than 40 services and programs so that Detroiters have equitable access to all elements of a healthy lifestyle so families can thrive and businesses can prosper. Denise was appointed by Mayor Mike Duggan in September of 2019. She and her team lead the response for COVID-19, and it is absolutely amazing. Denise earned her Bachelor's of Arts degree from the University of Michigan. Go Blue, I am biased. A master's in public health from the University of California, Berkeley, a master's of business administration from the Mike Ilitch School of Business at Wayne State. And you are an avid, I got a couple of people coming in here. You are an avid long distance runner, and my daughter is an Ironman. So I have an appreciation for that. Absolutely. And resides in Detroit with her husband. And what is your husband's name?
My husband's name is Razo. He is the director of Bridging Neighborhoods and also works for the city.
Oh, great.
Yes.
Well, with that, I welcome you. The intent of this session is to get an update from the city of Detroit. Welcome, Diane. Thank you for joining us.
Okay, thank you.
Got a couple more. Here comes Lori. Hang on. We'll get everybody in here. Hi, Lori.
There's not a direct line to reach the
community. Okay. If everybody could go on mute, with the exception of Denise, that would help. We won't get any feedback there. The intent of this session is an update on a session we did with Denise about 6 months ago, maybe longer, on COVID rolling out. And today we are faced with the pandemic still in front of us. And I just said, we have got to learn more of where we're at. And I also want to know what more we can do. The pandemic is not going to go away unless we work together to get rid of it. And there must be more things we can do, Denise, whatever they might be. And so I want to turn it over to you. And thank you again for taking time out of your day. I know it's at the end of the day too, but thank you so much for your time, update, and hopefully answer a few questions once we get an update.
Yes, well, thank you so much, Chip, and to Rivertown. It's always good to be back. I consider myself family, so it's good to be back in the family, a little bit of a family reunion. So I'm going to spend probably the next 10 minutes or so. And as you know, I do have my timer, so I can make sure I stay to schedule, because I'm definitely a talker. I want to honor your wishes, Chip, to talk about where we are and what we all need to do so that we can keep Detroit safe. So let me start by saying that when I spoke to you all back in January, actually, which was now, my goodness, 11 months ago.
Was it that long?
It was that long ago, from my understanding.
Was that in January that we? Oh my gosh, time flies. Whoa.
Yeah, and we were just rolling out the vaccine. So a lot.
That's right. That's right. Mary Sheffield is here. Welcome.
Right. Yep. So thank you. So we have come a very, very, very long way. The good news is that we do have vaccines, and the vaccines are now available to everyone over the age of 5 years old. So at one point, it was just available for those 65 years and older, and then 18 and older, and 12 and older. But just last Monday, we announced that those who were 5 to 11 years old are now eligible for the vaccine. And, you know, we have come a very long way. But as we look at the numbers right now, our numbers are worse than we were this time last year, even with the vaccine. And that's really, really disappointing. So let me just be really honest with you in terms of what I'm seeing as a health officer. What I'm seeing is people are getting too comfortable. We're not wearing our masks as much. We are not practicing social distancing, and we're assuming that everyone is vaccinated, but they're not. In the city of Detroit right now, 42.7% of all Detroiters aged 5 years and older have been vaccinated, which means almost 60% of people are not. And my job is to make sure that I provide enough education to Detroiters who are maybe on the fence and who have not, they have not taken the opportunity to get the vaccine yet. So my job is really to convince them and to provide them with education so they make an informed decision. So right now, cases are on the rise. In fact, I was just speaking to my team of epidemiologists, and the numbers have skyrocketed. So to put this into perspective, about 2 weeks ago, every day, about 150 people were getting COVID, between 150 and 200. As of today, it's about 350 people who are getting COVID every single day. And so these numbers are not decreasing, they're only increasing, and it's younger people. Younger people under the age of 40 years old are more likely to get COVID because many of them are not vaccinated. So recall, I just said that 42.5 or 42.7% of all Detroiters age 5 years and older are vaccinated. Well, of that 60% that's remaining, 50% of those people who are not vaccinated are under the age of 40 years old. So that's really the population that I'm trying to talk to convince. Also, our positivity has increased. We were at 4.3% just last week. Now we're over 7%, which means more people are testing and more people are testing positive. And about 30% of those people who are testing positive have been vaccinated. So let me say that again. Of those individuals, of those people who are testing positive, about 30% are already vaccinated, but they're still getting COVID because we know the Delta variant, which is about 100% of all the cases, the Delta variant is stronger and it's spreading even amongst the vaccinated. We're also at a very high transmission level. So if you recall, the CDC put out recommendations a little while ago, and they said, if you're in an area that has low transmission or medium, you're okay. But if you're in an area that has high transmission, which means that over 7 days, if it's more than about 100 cases per day, then you should wear your mask when you're indoors. You should practice all of other types of safety precautions. Well, for a while, Detroit was fine. We were low, but we have remained high, substantially high over the last several weeks. So it is extremely important for everyone to get vaccinated, not tomorrow, not next month, but today. And so we have provided vaccination events all across the city. Access is never an issue or has never been an issue in the city. We have drive-through at the TCF Center. We have extended hours on the weekend, after hours. We have Saturday locations. We're in grocery stores, restaurants, bars, churches, schools, you name it, we are there. And if there's any excuse, we're ahead of you. Because if you live in the city of Detroit, we'll come to you. So we will go directly into your home and vaccinate not only you, but also everyone who resides in your household. And so again, there's no excuses because there are multiple ways that you and your family can get vaccinated. So we know people have lots of questions about the vaccine. A lot of the questions are, what's in the vaccine? Why should I get it? You know, my friends have never gotten COVID, so I'm not going to get COVID, or I'm young, I'm under 40 years old, I'm not sick, so why would I get COVID? But the bottom line is COVID is no respecter of persons. It doesn't matter if you are white, if you are black, if you are tall, if you are short, if you are 85 or if you're 25, you could get COVID. And the only way to protect yourself is to get vaccinated. So we have my team, they're amazing. They put together all these educational sessions that are available on Facebook Live, Instagram Live, and also phone-based, where you can call in and ask questions. We have medical experts like physicians and nurses, and they're spending time out of their busy schedules to have a dialogue and to share what's inside of the vaccine and why you and your family should get vaccinated. So we have educational sessions, and then we also have a call-in number Monday through Friday from, I think it's 8 until 5, where you can call in and ask a question related to COVID-19 or the vaccine. We're also partnering with DPSCD, which is our school district in Detroit. There's 50,000 students in the city. And so we want to make sure that all students who want to get vaccinated can get vaccinated. And we have multiple clinics that we have set up in partnership with Dr. Vitti and his team. Now, there are 3 different types of vaccine, the Moderna, Pfizer, and J&J. And so we have, again, first and second doses and also third doses for those who are immunocompromised, as well as the booster shot for everyone over the age of 18 years old. And again, it's available at multiple sites across the city. You can mix and match if you want to. People have asked me that question. If they've had Moderna and they want to switch over to Pfizer, that's okay. If they had J&J, they want to switch over to Pfizer or Moderna, that's also fine. Again, you can just bring your vaccination card to any one of our sites. No appointment needed. Just come and get your vaccine. Now, the question I always get to is, what's the difference between third shot and booster? Does anybody have that question? I know everybody always asks. Third shot and booster, the only difference is who's eligible. So third shot is available for those individuals who have an immunocompromised system. So maybe they had cancer, maybe they had a transplant, but that's available for those who are immunocompromised. And you're eligible at least 28 days after your second dose. So once again, if you have an immunocompromised system and you took the Pfizer shot first dose and the second dose, 28 days after your second dose, you're eligible for another boost, which is a third shot. Now, the booster shot is exactly the same thing as the third shot, but it's only eligible for those who've completed their series 6 months after their second dose. So for example, they had Moderna, first dose, they had their second dose, 6 months later, if they're not immunocompromised, they can get their booster shot. Again, same formula, it's just the only difference is who is eligible. Finally, I know that the holidays are coming. I'm excited because I can't wait for turkey and dressing and greens and macaroni and cheese. I am just ready. But I know in the Fair Razo household, we are going to have a very small gathering, and everyone who comes over will be tested, even though everyone in my family is vaccinated. It's really important. And we have at-home test kits that we're going to use for my family. I'd encourage you all to do the same. Have your fun, have your holidays. If you're going to be indoors, make sure everyone is vaccinated. If they are not vaccinated, then please make sure you wear your mask, because you never know if COVID is spreading amongst your family and friends. So that's really important. Keep the celebrations small, keep them outdoors if you possibly can. But we know we're in Michigan and it's probably going to be 35 degrees on Thanksgiving. So you can wear your winter coats, or just make sure that you are, again, practicing social distancing and you are wearing your masks. And, of course, wash your hands and practice, you can use hand sanitizer. If you are traveling, because I know a lot of us may get on a plane to go and visit grandma and visit everyone else, make sure that you wear your mask when you are in the airport and also on the plane. But it's really important when you get back to quarantine for at least 1 week, because again, you never know if you have COVID. And even if you've been vaccinated, it's really important to quarantine for at least a week. So that is what I would like to share at this point. I want to open up for questions. I'm happy to answer any questions that you guys may have.
Well, let's open it to the group for questions that'd like to ask Denise. Go ahead, Jim.
Hey, Denise, that was very insightful. Appreciate it. So my question for you, I got a comment. Let me go with the comment first, and then I'll ask a question. But, I was vaccinated. I'm retired military. And I know some people they are just like adamant. There's no way in God's green earth are they ever going to get vaccinated. And it's, I don't know what it is. It's whatever it is. I mean, that's their opinion. And it's like, stop ramming this stuff down my throat. But in my family, or my extended family, there's two physicians, and they work at two different hospitals, and they will attest that most of the people, like 90% of the people that are in the hospital right now, are people that have not been vaccinated, or people that are in the hospital with COVID. Like, the numbers are way off the chart. I mean, way up there. Everybody, the people that are coming into the hospitals are not vaccinated. And so, I got vaccinated. I got to get my booster shot because I'm going to go down to Florida and see my dad, 93-year-old dad, and he insists on it. It's a retirement community. But my question for you, and I won't go to large gatherings, only because why? I'm not going to be in a big midst of a crowd of people. And when I know, and even last night I was in an event at the Detroit Historical Society, and there was two people standing there, and I said, "You've been vaccinated, right? You've been screened. You don't have COVID, right?" Because I want to know, right? And one of them was not vaccinated, and I'm just like, why would you not do this? I mean, it's pretty. There's very little evidence that you're going to have any side effects. And if you are, you're going to feel a little bit drowsy or whatever one day. And some people don't even get drowsy one day on their second shot. But my question for you is, because of the holidays are coming up, and you highlighted that there's an opportunity to buy a self-test kit. Did I hear that correctly? That I can go to like CVS or Walgreens and get a kit that I can test myself? Yes or no?
Yes. So there are at-home kits that you can purchase. I know at Costco, they have at-home kits. I'm not sure about CVS or Walgreens, but in case you don't have access to those at-home kits, you can always just get a test at the Joseph Walker Williams Center. We're open every day, Monday through Friday. I believe also on the weekend. I'll have to double check and get back with Chip. But it's always important to know before you go, and we recommend at least 72 hours before you go to a gathering to get tested. Again, you never know unless you get tested. In terms of large gatherings, I have actually found myself going to large gatherings just for purposes of my position, but I always have a mask. And I'll tell you, Jim, I'm usually the only one who wears a mask. And everyone looks at me like I have three horns. Seriously. And they're asking, why do you have a mask? Aren't you vaccinated? It's like, well, yes, I am vaccinated, but to protect myself and to protect you, I am wearing my mask. And I'll tell you, I went to a some sort of it was like a very elegant ballroom type of event, and my mask ruined my entire outfit, but it's okay because again, I felt extremely protected. So I hope that answers your question.
Thanks, Denise. That's great. Let me ask you this question. Are there any particular kits to follow up on Jim's question that you would recommend, or are there any names that you hear that are reliable?
Yeah, I don't have that level of detail, but let me do some research, Chip, and then get back with you and also speak to our acting medical director, because there are a list of at-home kits that are approved through the CDC. So I can find those, and then I'll send you a link so that you can send out to your members.
Because the reason I ask is I've read so much about some of these being recalled. Some of them are not, the right test result. And so, yeah, get that to me and I'll send it out.
Sure.
Here, my take for the group is this. COVID-19 has become page 2, okay? It is not in the forefront where it should be, because the numbers that you are citing here are dramatic. I mean, those are dramatic increases where you go from a 4% to a 7% positive. And where the city of Detroit, which is where I'm focused here, is at 42.7%. The state of Michigan, I think, is at almost 70, isn't it?
Well, so the state of Michigan's at 59%.
Oh, 59, okay.
Of those age 12 and up. And I think I think it's 70% for 16 and up, if I can remember.
Okay.
But still, Detroit is much lower than where we need to be.
So the question I have is how, and all of those accesses you have, some I did not know about, others I did. And I'll get those from you and I'll put them on my website, because I do have my button on there. If you've seen my button, I got vaccinated. That's from Henry Ford, because when you go in there for your shot, you know, it's sort of like getting a cookie and orange juice when you give blood. You know, they sit you down and they say, okay, stay here for 15 minutes and here's your badge that you've been vaccinated. We just need to be able to bring this back to the forefront so that we can get to the 40 and under crowd, that this is important. This needs to be done. And I'm just scratching my head on how do we do that? How do we help you make it page one or do something that is more intense than it is right now?
That's a really good question. We have, again, access is not a problem. So we've been out into the community, just pushing this information out. We've been talking to pastors and other trusted leaders in the community for them to share the message with their community. We've been in salons and barber shops, into the schools. But again, we really haven't made a lot of movement. And again, I'm really, really disappointed, but I'm also hopeful. You know, I said before, this is not a sprint at all. And I was looking at other counties to see where they are, but that's not my focus. My focus is the city of Detroit. And so it's definitely a marathon. And we're going to keep moving forward and do whatever it takes to get shots in arms.
What do you hear from the 40 and under crowd? I mean, obviously that is a target. I mean, what are you hearing from them? Is it, you know, like you said, well, my friends don't get it. I didn't get it. I'm not going to get it. I mean, what are they saying to you that we can focus on maybe to say, you need to get the shot? It isn't just that we want you to get it. It's for your own good health. I mean, what are they telling you as to why they're not?
So some people are in my peer group and they've said, I'm not getting the shot because I don't have any interest in it. I don't know, I don't know what's in it. I think, the government is spying on me because when they inject whatever it is, it's going to be a microchip and they're going to examine my every move. And I'm thinking, microchip, you have a cell phone that you are hooked to day and night.
Right.
So if the government is tracking you, I mean, have a cell phone. But the bottom line is, one, I want to respect everyone's opinion. And two, I want to make sure that I sound like a broken message or a broken record, because every day it's the same message of me sharing the importance of getting the vaccine. And whether it's me or whether it's a doctor, whether it's the mayor, or whether it's a family member, we all need to be on the same page with this information. And honestly, and I think the mayor and I were talking about this a couple months ago, I believe that many people have just tuned us out because we have become page 2 or even page 3, or even in the, end notes of an entire chapter. So it's really going to rely on family and friends and other trusted leaders in the community. So pastors and teachers, et cetera.
I want to open it up to other people as well, but one of the suggestions I had is has the mayor done a public service announcement, eyeball to eyeball, to Detroiters to say, I am your leader here, and I am telling you this is important. If you live in the city of Detroit, I encourage you as your mayor to be part of this team and to be vaccinated. I have not seen that. I have not seen him come out, and maybe I missed the public service announcement, but isn't that something you think might help encourage that group that voted for him?
You don't see everything. There's a lot of work that goes behind the scenes. Our mayor is out in the city every day talking to residents one-on-one. I think those are the conversations that are really, really important. But every day there is an acknowledgement of COVID, not only from the mayor's office, but from the Detroit Health Department. We're in the media, but we're also going door to door. We've knocked on 320,000 doors since June, having
Wow.
one-on-one conversations with residents saying, here's information about the vaccine and here's where you can get it. And by the way, I will sign you up for an appointment right now. So I think the health department, the city, we've done an incredible job of getting the word out there, and our mayor has been leading us the full way.
That is great. Let me open it up to other people who want to ask questions. I mean, this is a passionate note here. Anybody else? Tom, you want a question?
Yeah, I've got a whole list of them here, but
Oh,
for openers, as far as the home testing goes, there's an instant test and a PCR test. Is that right?
Yes, there is. And so what we do for in-home testing, we use what we call the rapid test. And so we have a team of nurses and we go door to door and we swab residents, and then we take the sample back to the lab. And then within about 15 or 20 minutes, we have a result. And we
Wow.
call the person back and we share those results with them. So every resident gets their results same day.
What about the test they sell like at Costco? How
So
does that
those
work?
those are at-home tests. And so you are swabbing both nostrils and you put the sample into a solution. You monitor the sample for about 15, 20 minutes. And then I believe if the color turns a certain color, then that means you have COVID. If it's clear, then you don't have COVID. But each kit is completely different. But what I'll do following this call, I will go onto the CDC's website to look for the approved list of all of the at-home tests. And I'll send it over to Chip.
That'd be great. Yeah,
Mhm.
that'd be great.
Sure.
You said 30%, roughly 30% of the new cases are breakthrough.
Mhm.
I had heard something earlier in the week that far and away, the greatest percentage of breakthrough deaths are in people 65 and older. Speaking of somebody 65 and older, don't laugh, Chip, you're in that range too.
I don't know anybody older than that.
Is there anything extra special we should be doing? Do we just stay out of restaurants entirely? Do we not go to any kind of group gatherings?
I would hate for you to live that kind of life where you were just at home in a bubble. If you are vaccinated, I believe wholeheartedly that you should live your life, but also remembering those safety precautions. So if you go to a gathering, it probably would not be wise to not wear a mask because you don't know who's vaccinated and who's not. And the person, and even though you are vaccinated, if there's somebody next to you who is not, they could be a carrier and you could get COVID, you could have a breakthrough case. And if your system is immunocompromised, then you may not, like your chances of survival are pretty slim, which is really unfortunate. So I would not advise to be comfortable and to let your guard down, but I would encourage you to remember those safety protocols. So especially when it comes to, again, Thanksgiving and Christmas holidays, have fun. Have fun wisely.
That makes good sense.
Mhm.
Just one other thing, when you see on the news and that where they say there's however many 3,000 new cases reported and 130 new deaths, 78 of which are from review. What does that mean exactly? What are they reviewing that they decide after the fact?
So for example, in the city of Detroit, over the last 2 weeks, we had an increase of about 1,000 new cases. Those numbers are always under review. And we have at least 4 or 5 deaths every week. Sometimes those deaths are, they're not accurately reported because, and there's a whole process, but when you pass away, the medical examiner has to indicate the reason for a death. And sometimes the person, well, the medical examiner will put, you know, the deceased died due to COVID, or it could have been a mistake, and they will revise it. And so if that happens, if there's a mistake, then we are notified. So those deaths, the data is always under review. So there could be 73 cases from all those counties that are currently under review. That's typical for data. But in the city of Detroit, that hardly ever happens where we have, like, we've over-reported or we've under-reported. That hardly ever happens. But when it does, we do acknowledge it, we correct the mistake, and then we report the correct number.
Very good. Thank you. I wondered about that because it's,
yeah,
you wonder who's not watching what's going on.
No, I mean, it happens.
Brian, you got your hand up there. Brian, go for it.
Sure. Denise, again, congratulations on your new nuptials and all that you do. Definitely appreciate you.
Mm-hmm.
I have a question about the type of mask that we should wear, because you hear a lot of things about you need to wear a KN95 mask, or a cloth mask isn't good enough. You can wear it, but it doesn't really stop the transmission. So people wear a mask, but I'm taking care of my 90-year-old mom, and I just want to make sure I minimize as much risk as I can. I wear a KN95 mask, but other people don't. So, you know, if you're going out in public places and you're trying to minimize that risk, what do you suggest?
So let me give you a quick way to know if your mask works. I wear perfume. I love perfume. That's like my favorite thing to do in the morning, put my little perfume on. So if I put on a KN95 mask, and if I spray perfume, and if I can smell it through this mask, guess what? My mask does not work. So typically, if you put on a cloth mask, you'll be able to smell whatever is out in the elements. And that's when you know the mask does not work, which is why some people wear two masks. But with a KN95 mask, which is what I always wear, or a regular N95, those are the best. But at this point, if you don't have a KN95 or a, try that again. If you do not have a KN95 or N95, then use what's available to you. So that would be my recommendation. But the smell test is always the easiest. Mm-hmm.
That's great information.
The smell test.
Go ahead, Diane, you got a question?
Not a question. I admire Denise's persistence, because I think we're all so tired of hearing about COVID. We want to just ignore it. And I don't know that people care anymore. We're just so tired of it. So I admire your persistence and keep knocking on doors, trying.
Thank you, Diane. That's the question I get all the time. It's like, aren't you tired of what you're doing every day? You know, like, haven't you done enough? No, we have not done enough. We have continued to evolve. That's what we're doing. So we've done so much, but there's still so much more to do because not everyone is vaccinated. And are we tired? No, we energize our buttons every day. You know, we may leave late, you know, it's late right now. We leave the office late, we go home, we do some more work, we get recharged, and we come back. But what I'll tell you, I am hopeful. I am hopeful that we will be able to keep on vaccinating and educating people and you know, still remaining positive.
That's great. Other questions? Any other questions anybody has that for Denise?
Actually,
Lori.
I have a question, Chip.
Okay, go ahead, Lori.
Thanks. Hi, Denise.
Hi.
Congratulations on your recent marriage.
Thank you.
My question is about maybe partnering with sports arenas. We have season tickets to the Pistons, and I'm amazed at how we are packed in. And my husband and I are one of, it seems like a handful of people wearing masks. And there's no mention of COVID. There's no mention of being careful. So it might just be a kind of a natural place to talk about the vaccine or warn people, or at least ask them to wear masks.
Yes, Lori, thank you so much. That's a really good idea to reconnect with the sports arenas. I know over the last several months, we have met with pretty much every major sports arena in the city of Detroit. They've been really great about allowing us into the sports arenas, reviewing all their protocols, conducting walkthroughs. I know my team, Scott Withington and also Dr. Dunn, have spent, I'd say, probably 20 hours a week just out and about making sure that the sports arenas have what they need from the health department. But we know that there are no mask mandates in place throughout the entire state. So because of that, we continue to provide recommendations for wearing masks, but it's really up to the owners of those facilities to ensure that COVID is not page 2 or page 3. We have partnered with sports arenas to do vaccination clinics on site along with free tickets. So that has been great. But there is definitely an opportunity for me to sit down with them and say, hey, where are we? I know the stadiums are packed, the games look fun, but let's not forget that COVID is still here, and COVID is not going to go away unless we decide to take this seriously.
Oh, and then, the Rolling Stones were here on Monday. That was packed. The other question I have, we are at Pace Southeast Michigan, we're funded by CMS. So we are under the vaccine mandate. Through your education throughout the community, is there any that you found resonated better with, as you were teaching and educating? Because we have 600 employees that we need to have vaccinated. And there's reluctance naturally, like within the general population. So any tips or guidance you can provide on that would be great.
I think it's helpful to have just general conversations like we're having right now, real kind of non-stuffy conversations, and a kind of open dialogue so people can ask all types of questions. I know both me, the medical director, a couple nurses, we had meetings with several departments within the city, and it was open and honest, and people were just talking about all types of things in their lives as it relates to COVID, and it was great. So creating that safe space that allows people to have conversation is extremely helpful. And then also sharing data. So stating the fact that, hey, over the last several weeks, X number of people had COVID, X number of breakthrough cases, and you can rely on the Detroit Health Department. We have all that information available on our website, or you can just go to the state of Michigan, type in your zip code, and see where COVID is prevalent in your zip code or in your region. So we have definitely become a little bit more advanced over the last 20 months. And if we can be of any help to you, I'd love to come and talk to your staff. So just let me know.
We would love that.
Oh, yeah, sure.
In fact, I was going to ask you, we're a healthcare organization. We take care of low-income seniors throughout Detroit and Southeast Michigan. We would love to have you come and tour our facility in Rivertown.
Would love to. Actually, Chip has my information.
Okay.
So I'd love to come by and say hello and then connect with your staff.
That'd be great. Chip, sure. I'll reach out to you for that.
Okay. And Denise, will you send me their website? I'll put that on our site as well.
Yes.
Because I do 2 emails a month, and like I said, I've got my button on there. I got vaccinated, but I think if we can do more by giving more information on how people can do it, because it may be as simple as I don't know what to do, as opposed to I don't want to. Maybe I want to, but just don't know where to go. Excuse me. And who do I contact? Or as you said, Denise, informationals. Like this. These are casual conversations of what it is. It's almost like a house party, like the mayor had his house parties.
Yep.
It's get together and just talk about it and realize that, this is still a real threat to the community. And this is not going to go away unless we do something about it. And we just can't sit back. I mean, you just can't say, I'm not going to get it. Well, it doesn't work, because you will get it. And any of you who subscribe to the Free Press, on Sunday, they run a special section and some of the most heartbreaking stories of people who have died, in some cases, husbands and wives together within months because of COVID, and they didn't have the shot. and they profile these stories so that people can realize that this is a real problem here. It isn't just something, and I agree with Lori. You go and you got 40,000 people at the Rolling Stones, and I don't know whether they required COVID or not. There was no requirement. I know Live Nation is requiring you must show a COVID vaccine that you've been, or a negative test before you can go. And I don't know who put that on, but when you have 40,000 people packed in that arena, I mean, there's no telling what's going to end up having after that. But those are the kinds of things where people say, well, there's no big deal. There's 40,000 people at Ford Field for 3 hours and the Rolling Stones, everybody's happy. Yet the reality is some people are going to come down with COVID. So we need to do more. That's all I can say, whatever it is. Any more questions? Brian, you got your hand still up, or you have another question or?
Yeah, I do have another question. And I actually thought about, Denise, I work with Visit Detroit, and we handle a lot of conventions that come to the city. And I must say, I've learned so much about COVID and protocols in the last 6 months. It's been crazy. But I had reached out earlier this year to Alexis Adams. I don't know if she's still with the organization, but we had conventions having questions about, coming to the city. What are the protocols that are in place as far as pre-testing, pre-verification, and things like that? And I did reach out to some companies, Clear, Share My Health, and some other companies. But is there a way that we could probably have somebody from your office come out and talk to conventions, or a meeting planner if they're coming in? Because they want to be comfortable knowing who they're sitting next to. And I know some of the onus is on the organization to set those protocols. So, just to set their mind at ease. Before Detroit was associated with crime. Now we got COVID out here and they're worried about that. So if we can just kind of calm their fears.
Yes. So once again, Chip has my information.
Okay.
Dr. Dunn, who's our acting medical director, and also Scott Whittington. They are a dynamic duo, and they will come and meet with you and anyone on your team, or anyone who's coming to the city who wants to have large conferences. So definitely we can provide that to you.
Okay. Yeah. Because we just had our first robotics just canceled because they just couldn't handle coming in, and they do students from 5 years old to 12th grade, and they just couldn't handle the risk of coming in. So. Thank you.
That is a problem. Now, let me ask you, Denise. I know that we hope this goes away. It's probably not going away. It's going to get worse. And in the school systems, and some are requiring masks and some are not. I mean, do we get to the point where the health department in the city of Detroit or the state says, something, we got to get our arms around this. We're going to have to wear masks indoors. I mean, are we close to that? Where are we in maybe requiring that? If you won't do it yourself, then I'm going to help you do it.
So I would like to get that formal recommendation from the governor's office. And so far, we have not received that recommendation from the governor's office for masking indoors as a mandate. However, from the CDC, that is a strong recommendation for students, for residents living, in an area that has a high transmission of COVID, to wear their masks indoors. Again, it's not a mandate, but it is a strong recommendation. I know here in the city of Detroit, as a business, not as a city, but as a business, we are strongly recommending wearing masks. We have meetings all the time. And so it's important to wear your mask or have some sort of hybrid setting where you have people on Zoom and also in person. Whatever we can do to mitigate the risk, that's really important.
That's good. We're just about, thank you for all your time, Denise. This has just been so helpful. Jim, you got your hand up. Do you have Denise, Diane, you got a question?
There's a question in the chat box.
Okay, I am not watching my chat bot here, so I should say. This is from Leah. I work in youth development ages 14 to 21. Is there data for that group, and what are the numbers like in schools, and how much transmission is happening at schools? Thank you, Diane.
Well, so I just had a good conversation with Detroit Public Schools Administration team, and this is all public information. But over the last week, they had about 300 and I think it's 358 students who were either exposed to COVID or in quarantine. And that's really unfortunate. And so we know that COVID is spreading in schools. And just yesterday, Dr. Vitti, who's the superintendent, announced that all DPSCD schools will go virtual 1 day a week, I believe on Fridays, and that would be helpful to mitigate the risk. So I was very pleased with that recommendation. I think it's the right thing to do in order to mitigate the risk, but the numbers are very high. And I hope those numbers will decrease as more children who are eligible get vaccinated.
Great. Leah, thank you for that question. Jim, do you have a question? I see your hands up, or is that the last one?
No, so it's really just a comment to you, Denise, but I went to a USS Paul reunion because my first ship, about 50-year reunion in Norfolk. I drove because I no longer like airports. I mean, they're just so inconvenient. And went into the Sheraton. There's about 140 people, and most people didn't have face masks. And, you know, on the other hand, I see some person driving in a car, and they're the only person in the car, and they got a face mask on. I mean, it's kind of weird. But the reality is, most people, like in Norfolk when I was there, I think I saw 20 people with a face mask on. Okay. And I'm getting to the point where I got to protect myself from other people, because other people really don't care about me. So I'm looking at really kind of self-preservation here, maybe being a little selfish. And that's why I was asking about the self-test kits. I'm going to go out and get some, make sure everybody's tested. We trained Sea Cadets last weekend, and I asked, we had them fill out the form. You know, are you vaccinated? Do you have any symptoms? Blah, blah, blah. And, you know, we have to be on the defensive, unfortunately, because most people just walk around, you know, in malls. And I remember I was up at Great Lakes Crossing, and there's hardly anybody with a face mask on. And I'm like, this is like insanity. But so I'm going to work on self-preservation and protecting myself. And I just wanted to give you that feedback, because I think really that's what we're going to have to go to, because some people just are adamant. There's no way on God's green earth they're going to wear face masks.
So Jim,
they're never going to get tested. They're never going to get vaccinated. And it doesn't matter how dire the situation is. They're just not going to do it. Over.
So Jim, just thank you for your openness and your honesty. What I will say to you is, you can definitely think of it as self-preservation. However, when you protect yourself, you're actually protecting me. When you protect yourself, you're protecting Diane. When you're protecting yourself, you're protecting the entire city of Detroit. So keep on working on your self-preservation, because it's going to protect all of us.
And I agree with Jim. And I know when the mask mandate came off, it said, if you are not vaccinated, you are to wear a mask. Yet I think that went out the window. People saying, well, I'm not telling people I'm not vaccinated. If I wear a mask, they're going to look at me like I haven't been vaccinated. But that is the requirement. If you have not been vaccinated, you are supposedly indoors to wear a mask. But that just is not being adhered to. Well, let me just ask the group, last call here for questions for Denise. Anything that we have not asked. I know that she's available certainly for questions afterwards, and I will put your information out as well, Denise. Sure. And thank Kiki very much for all of her help. She's always that's Denise's right-hand person there. She's very helpful in making sure all goes well. But I will just say this has been great. I think we've achieved what we wanted. We created some additional awareness here, talked about action steps. We are here for you. If there's anything we can do to help spread the word, do anything, you just let us know. My emails go to 3,000 people when they go out, and they're spread out all over, not just Detroit. It's the greater Detroit area, plus around the country. I have people who are very interested in what's happening in Detroit. And what Brian said, there's a lot of people who are saying, okay, I want to go to Detroit, but now they hear that Michigan is the epicenter of COVID-19. Okay, and they start doing the numbers, and Brian knows, you start looking at the numbers, and you say, whoa, look at Detroit. Now all of a sudden, if you're a meeting planner, you got a lot of money on the line here because you have to be able to fill those rooms and do all that. And if people are not certain that they want to go there, they aren't going to come.
Right.
And so I think that's an important point. But we're here for you, Denise, and on behalf of the group here, just say thank you so much. We'd love to line you up, say, in 6 months and have you come back and give us an update. And hopefully it'll be a better report and we'll be able to help you do it.
Hopefully when I do come back, and thank you again for the invitation, I must be doing something right. Maybe the report is only 2 minutes. I'd love to say, everyone is vaccinated in the city. Let's all get back to our normal lives. So let's hope and pray.
Well, thank you so very much, Denise,
Thank you.
and have a happy Thanksgiving. Happy Thanksgiving to everybody. Our next Rivertown meeting will be Thursday, December 16th. And I am just finishing up on that. You'll see something coming out on our guest in a little bit. Thank you all. Have a great Thanksgiving. Thanks, Denise.